Hi, I'm Donna Taylor, and today I'm going to present to you the strategic plan for the Heart Valve Center at the Chester County Hospital. This has been a long-range goal for the hospital, and regional and national statistics show that there is a large patient population that is undiagnosed. These patients have moderate to severe valvular heart disease, and these are the patients that we are hoping to get into our program. We've done a SWOT analysis, and our strengths and opportunities are great. The strengths include experienced cardiologists and cardiothoracic surgeons that will be willing to work in the program. And we also have senior administration on board. They are willing to devote time for planning and also financial resources for marketing and extra nurses to work in the Valve Center. We're also fortunate to be part of a larger healthcare system. Chester County Hospital is a community hospital, but we are affiliated with the Hospital of the University of Pennsylvania, and that's in Philadelphia. And that hospital has an excellent reputation. They do research and many innovative procedures, and this Heart Valve Center is going to hopefully be successful because we have their help. Opportunities. Patients are living longer, and as patients live longer, their heart valves kind of wear out. So those are the patients that are going to be coming into the Valve Center. There's a greater incidence of valve disease with older people, and it's documented. As I was saying, our affiliation with the University of Pennsylvania is really great because we are going to be able to use some of the staff members there that have been working with patients that have valve disease for quite some time. So how are we going to do this? We've never done this before, so we are going to need some educational, we have educational needs. Nurses are going to be needing to learn more about the whole center, how to run it, what the patients need, and we also are going to have to educate our primary care doctors and cardiologists. The more people we can educate, then they will send their patients to the Valve Center, and then we will actually meet our goal. So our mission actually is to provide each patient and their family with an outstanding experience and improve the health of the community through the development of the Heart Valve Center. So with our SWOT analysis, we actually identified our strategic goal, and that is over the next 2 years to develop processes and to identify and collaboratively provide a plan of care for valvular heart disease patients, increasing our surgical volume by 10% each year. So that's a high goal, but we think that we can do it. Let me tell you how this program works. It's very unique. A patient with valvular heart disease will come into the office for a consult. It will be a collaborative consult between the surgeon, primary cardiologist, and the lead nurse practitioner from the University of Pennsylvania. They'll take a look at all the patient's data. That's why we need to get all our ancillary departments on board. Pre-admission testing, the pre-admission testing would be, the ancillary departments would be radiology, laboratory, pulmonary function testing, non-invasive cardiology, and scheduling. So all those departments are going to need some education as well, and they are going to need to have frequent little bits of education as we go throughout the process. So when the patients come into the Valve Center, they see these 3 practitioners, and they together look at all their data and provide a plan of care. So the patients may be having surgery. They can have that at the community hospital, or if they're more high risk, then they can go be transferred to the University of Pennsylvania, where they provide more advanced, innovative procedures like TAVR and MitraClip. So the great thing about this program is the patients can have most of their medical visits at the community hospital, which is local, and they only have to go to the University of Pennsylvania for their procedure. They can actually come back to Chester County Hospital for their post-op visit, which is really great, and that's a very good patient satisfier since they don't have to travel a distance. They can have a local community hospital to provide the service that they need. So how are we going to evaluate this program? There's qualitative and quantitative. So qualitative, patients are given Press-Ganey surveys, and these surveys are random. Patients can actually give us an idea of how well we're doing our job, how well we're providing care. The quantitative evaluation would be just the numbers. We're going to be tracking our surgical numbers for Chester County Hospital and also the Hospital of the University of Pennsylvania. We'll be tracking the innovative devices, will be how many TAVRs we're doing, and we'll get the downstream revenue for that. We also want to take a look at the physician referrals, and find out which doctors, primary care doctors and cardiologists are referring into the center. We want to do this because we want to thank the ones that are, and the ones that aren't possibly need more education. So then our doctors could go out and give an educational lunch to help everyone understand what the Heart Valve Center is about. So that is basically it in a nutshell. And now I'm going to take some questions. The first question is from Kathy, and one of my classmates from our forum, and she asks, do you alert facilities or providers outside of your organization? Well, great question. Yes, we do. And many people come in as outpatients to have their echocardiograms done, and that's the primary way we identify our valve center patients is through echocardiogram. So if the patients have an abnormal echo, then the nurses will call the doctor that ordered the test, and they will also follow up by sending them or faxing them the report so they can understand what's going on in a timely basis. We also would send with that an informative letter which explains what we do at the Valve Center. So thanks for that question. Next question is, how are you made aware of patients that have valve disease? Well, like I said, we initially find them through the echocardiograms, but we have worked with our nursing informatics and our IT department to develop an electronic alert. So patients that are in the hospital that don't have a cardiologist are electronically alerted, and the nurses are made aware so that they can follow up with these patients on an outpatient basis, which is really great, a good follow-up for the patients. And the final question is, how are you going to market your program? And we have nurses, a nurse liaison that works with all our physicians, and she is going to work with our cardiothoracic surgeon to get some information, maybe just a down and dirty piece of education on valve disease, and she's going to give that to them with collaterals that have been developed. So that's basically how we're going to market the program, as well as internet marketing and newspaper and radio. So that is the Heart Valve Center strategic plan. Thank you for listening. I've really enjoyed presenting it to you.